Hello everyone, welcome to the whole wide world of cardiology. This is Dr. Jaitly. In this video section, I'll be talking to you very briefly about the fundamentals of what is a left ventricular assist device. It's also called LVAD. Now there's a right ventricular assist device, it's called RVAD, and then you have a biventricular assist device that's called BiVAD. So for practical purposes, we'll discuss LVAD because the function pretty much is similar in the other two types, and because it's most commonly implanted, so therefore LVAD becomes the prototype here for now for our discussion. LVAD, as it's also known as, is an implantable heart pump that takes up the function of the failed left ventricle, and it pumps blood through a tube to the aorta, powered by a battery source outside the body. So what is it? It's a tube which is connecting the left ventricle, the failed left ventricle, to a pump which is implanted next to the heart, and that pump is sending blood over via a conduit or a tube back into the aorta. So the left ventricle is eased, quote unquote, or is helped or assisted, if you will, as we say, in order to see if the oxygen demands can be met for the body by improvising simply by adding another pump here. Because what is left ventricle ultimately? The principle is that it is a booster chamber. It's a booster pump for the rest of the heart. So in other words, or for the rest of the body. So essentially what it does is it really pumps every beat, and that is a stroke volume, and stroke volume times heart rate is cardiac output, as we know. So the cardiac output is being maintained by this left ventricle here. Maybe in the right panel it looks better here. And so left ventricle is constantly sending blood up in the aorta every single beat in order to meet the needs of the demand of the body for oxygenation. Now, if the left ventricle has failed, then this tube is inserted. It's a surgical procedure, obviously, so patient has to be hospitalized, anesthetized, and it's a major procedure. It takes several hours. Patient has to be on a heart-lung machine, just like in a bypass setting. And then a tube is connected into the left ventricle, and the pump is externally placed just outside of the heart, but still internal, inside the thorax or chest. And then a conduit or a tube is connecting to the aorta. Now, obviously, this needs to be powered. So there is a wire that comes out of the skin, and that's connected to a battery source or to the main current supply. So the issue here is very clear that you've been able to improvise or assist the failed left ventricle by a pump that's implanted right next to the heart with a conduit connected in this fashion. Okay, so now where would you use it? That's the biggest question. So because it's a very expensive deal, obviously it has to be extremely uncommonly done, and only at referral centers, even after 5 years, perhaps some of the top-notch referral centers have done maybe a few hundreds only. So there is a need to research further and to move ahead, because it's a very innovative technology, and we're improvising it every year or 2 years, and getting smaller pumps, getting more efficient pumps, less complications, and more battery power. And I'll talk to you about in a second how we are getting into wireless technology as well. So anyway, so the indications for this LVAD are: one, while somebody's waiting on the waiting list to obtain a heart transplant. So when somebody's waiting for a heart transplant and he or she has been designated as an end-stage cardiac failure or heart failure, at that point, patient is placed on a waiting list to be matched for a donor, and so it's like a bridge. So until then, because the patient is already on tremendous amount of anti-heart failure medications, so it could be a bridge. It could be used as a bridge while awaiting a heart transplant. The second place where it's used is where somebody has advanced heart failure, but the chances are he or she will regain the function of the left ventricle, and the cardiomyopathy or whatever the heart failure causes will regain its function. So to assist and tide over that acute crisis, if you will, of that severely impaired heart function, and LVAD can be indicated. So that's like for a temporary time only. And the third common indication is where a heart failure patient is designated as advanced end-stage heart failure but does not meet the criteria or is sick enough or has other systemic illnesses where is not a candidate for heart transplant. So, and in that patient, obviously, the entire heart failure medication and the intense treatment has all been exhausted and tried. Then only LVAD can be indicated. Now, with improved technology, it has become smaller, as I said, and has been used for RVAD as a right ventricle, or sometimes both ventricles. So you may end up similarly getting, a pump from the right ventricle going to the pulmonary artery, and then so it's a little obviously more complex type of pump at that point. But LVAD is the prototype as we see, and these are the most commonly ascribed or prescribed pumps for now. The progress in the coming years will eliminate hopefully the external battery source, and we are getting into wireless technology from what I hear and read, with more flexibility to the patient, because right now it seems like the patient has to tag around with this battery power wherever he or she wants to move around within the room. Obviously cannot do a lot of things outside of the house because the battery power is again limited, and you have to plug it in to recharge it all the time into the wall current. Now, so we are getting into a technology where there might be a wireless technology, and so this whole thing will be eliminated, and this could be powered by a suitable advanced technology system to power the battery. And then, of course, it becomes a very accepting device for most patients, because then the patients can move around, they can drive, they can even swim or shower, etc., freely without any encumbrances. And improve quality of life, which is the ultimate goal, and obviously improve survival. And that is the major nutshell of putting these patients on LVAD, is an exceptional, innovative measure. The severity of the advanced heart failure will actually determine the outcome of the LVADs. Like the sicker the patient, the lesser is the outcome, or the poorer is the outcome after the LVAD. So the research is now warranted to include patients rather than have them wait out to advance so much into their heart failure illness that now they're IV dependent on medication and have had repeated hospitalizations. Idea is to include them a little earlier before they advance too far. In other words, the patients who were considered too well enough to receive LVAD should be included into the study and compared against the group that is receiving intense advanced heart failure therapy, and then the two could be compared to see that the LVAD outcomes, whether or not they are better than the intense anti-heart failure therapy, etc., etc. So in a nutshell, a ventricular assist device is being again, it's a very rare placement done into implantation done in a patient, and it's done at very top-notch referral centers only, where the experience is extremely limited but very defined, obviously, and used primarily as a bridge, either awaiting a heart transplant while you're on a waiting list, or if the person is not a candidate for heart transplant but has advanced heart failure and all the treatments being exhausted, or if it's a weakened heart and the chances are that the heart failure will regain its function and the left ventricle will regain. So to tide over that emergency crisis, one can be prescribed LVADs. Okay. Hope you enjoyed this section, and stay tuned for more intricate stuff as we go along. Thanks so much.